While still in the health sector, Neurosurgeons and Pediatric Society of Ghana say they are gravely concerned about the shortage of vaccines for children across the country. Now, 2 crucial vaccines for babies have been unavailable at the Adabraka Polyclinic Vaccination Center for close to a month, leaving many babies without shots. Mothers who had come with their babies to be vaccinated were turned away to come later when the shots are available. Neurosurgeon Dr. Hadi Abdullahi and Head of Pediatrics and Child Healthcare at the Tamale Teaching Hospital, Professor Al-Hassan Abdullahi Mumin, have been responding to why their departments are concerned about the shortage of baby vaccines.
This shortage didn't just happen this month or a month ago. It's been more than 1 year since we started experiencing these shortages. So it means that for most of the children who were born during this period since 2022, they are likely to have missed so many of these vaccines that are very crucial to their survival during the first few years of life. The situation is quite bad because, for instance, in the northern region, there is no district that has not recorded maybe an outbreak of measles. So all the 16 districts that we have in northern regions have had cases of measles. If it's just the fever and the rash, generally we are able to manage them as home cases. So you can send them home and then they will be managed at home. But if they develop complications like the breathing problems, then they need to be in the hospital. And this is the key complication that can lead to deaths in children that have measles. And that is why this is a very big problem for all of us as a country.
The long-term effect of some of these infections, especially measles and rubella, could have an impact on the babies that will be born later on, because some of these conditions eventually could affect the development of the child's brain or the central nervous system, and in some cases the peripheral nervous system as well. So these children could be born with all kinds of brain abnormalities, and we know what pertains in northern Nigeria and some Islamic countries where we've had some Muslim clerics advising against vaccination, and we know polio is still not has not been eradicated in those countries, and we've seen the impact in those countries. You know, in their case, they didn't want to do it, but in our case, we have Ghanaians who are willing to have their babies vaccinated. And so as a country, if we can't get the vaccines, it's unfortunate.